Good evening. This is Dr. McDaniel. It's Saturday, April 27th. I'm getting this one in under the wire, as I stated. It's getting late. It's been a busy day, beautiful day here in New Jersey. Let's see, yesterday I started the discussion on menopause, changing shifts from abnormal bleeding previously to now no bleeding. So menopause, as I stated, is considered within normal limits if the woman is 42 years or older. The average age for menopause is between 52 and 54. I have seen women up through 56 years old. 57 was, I believe, the oldest woman I've seen had as a patient who had yet to go through menopause. We did a full evaluation and she was still just having normal menstrual cycles between 56 and 57. The average age is 52 to 54. As I stated yesterday, most women go through menopause around the same time that their mothers or older sisters did. If someone is under 42 years old, that's considered abnormally young. So premature menopause, or what we call premature ovarian failure. And in that case, an evaluation is undergone to determine if there's a pathologic or a medical problem that caused them to go through menopause early. In general, a well-known condition that will cause early menopause is renal failure or kidney disease. So if someone loses function of their kidneys because of the hormonal changes that occur, they can go through menopause earlier than they naturally would have had they not had the kidney disorder. That being said, the most common signs and symptoms of menopause can occur anywhere from a couple of months before menopause, on average between 1 and 2 years before someone is considered menopausal. And menopause is considered to have taken place if someone has not had a menstrual cycle in 12 months or more, and she either has the gambit of signs and symptoms of menopause and or has undergone a blood hormone evaluation that confirms her hormone function is menopausal. We call someone perimenopausal, that they're circling around menopause, so perimenopausal, if they are having all of the signs and symptoms of menopause and or their hormone levels are consistent with menopause, but they have not yet had more than 12 months of not getting their menstrual cycle, or amenorrhea is what we call that. The generally accepted signs and symptoms of menopause are several. The most common ones are hot flushes, either during the day or throughout the evening, night sweats, which predominantly occur at night when someone's trying to sleep, but they can occur throughout the day also. In general, most women consider or would describe a hot flush as being normal, no warning, and then suddenly but surely their face and chest gets hotter, their cheeks get hot, their just upper torso gets hot, not including like the lower abdomen or anything, but just the chest, neck, and face gets hot. Oftentimes it will just be the hot heat, and then it will go away after a few seconds, but usually it's accompanied with, after that flush of heat for no reason, suddenly just beads of sweat coming from the crown down. That's the most common scenario for hot flushes. Most women, if they first start getting hot flushes, will just have the cheeks and face get hot, and then eventually as they kick into their stride, I suppose, it'll start to be the chest and the face gets hot, and then it'll come up like a flame, where women describe just suddenly the chest gets hot, its neck gets hot, and then it just rises up to their top of their head and then drenched with sweat. I've had patients who have had to keep 2 to 3 changes of blouses at work because they've drenched their clothes so much they're soaking wet. They have to change their blouses several times during the day. Some women will have hot flushes and sweats just a couple of times a week. Usually when they start, it'll just be a few times a day or a few times a week, and it'll come in batches. So they'll have maybe a week, 2, even 3 weeks where they'll have these hot flushes with or without the sweats, and then they'll go away for weeks, or months, and then they'll come back again. So it'll kind of wax and wane. Could be a couple of times a month, could be a couple of weeks, but spread out between 3, 4, 5, 6 months even. So it comes just kind of sporadically, intermittently, without an obvious rhyme or reason. So hot flushes and sweats are the most common. They're the kind of the stereotypical symptoms. In addition to that will be any kind of symptoms that are associated with premenstrual symptoms. So moody, irritable, angry, anxious, depressed. Those are the most common. Fatigue, insomnia, lightheaded, dizzy spells, muscle aches, flu-like symptoms, joint pain. Mood is the most common of them. After that, it's going to be appetite change, either increased or decreased appetite, bloating. A lot of women complain of skin dryness and hair dryness along with hair loss. Change in libido or sex drive is very common. And a lot of women complain of being foggy-headed or what they call it, like a senior moment, where they are forgetful or their memory's not up to what it used to be, or a lot of short-term memory issues are very common. Those symptoms in association with intermittent menstrual cycles, where the woman stops having regular monthly cycles but has them every several months, or goes 2, 3, 4, 5 months in a row with no cycles and then suddenly has a cycle. Those are kind of the start stops to the irregular cycle pattern, and that's from anovulation. So the same changes that occur when girls start their menstrual periods, which we call a menarche, or the onset of menses, are the same kind of symptoms oftentimes when they stop getting their menses with menopause. So either light or shorter cycles or skipped cycles is very common. One can address the treatment or the alleviation or decreasing those symptoms either with herbal supplements or medications. Herbal supplements or self-treatments can be purchased at any of the local health food stores. So Whole Foods, Trader Joe's, mom and pop natural supplement stores or vitamin stores. They all carry the same supplements. The most common ones that will address mood swings, irritability, anxiety, depression, that's going to be the Remifemin, which is plant herbs, a combination or a compilation of plant herbs. Estrogen, which is also the same thing, combination of plant herbs. Evening primrose oil is often useful for mood swings, irritability, emotional, and for breast tenderness and bloating or breast fullness issues. Common one for anxiety, depression also is St. John's wort. And a lot of women for hot flushes and sweats that are just intolerable and create difficulty with activities of daily living, as we like to say, is 100% natural progesterone cream that is placed on the pulse points, so either on the wrist, the chest, the abdomen, or the thighs, in conjunction with let's see, progesterone. I guess I had a senior moment. That's in conjunction with teas or tinctures that also help balance the emotional issues and the hormone levels. So I'll think of that in a moment. I don't know how I just spaced on that one, but those are the most common ones. Let's see. In addition to that would be oh, and then the last one I forgot about was also a lot of women complain of vaginal dryness and discomfort or irritation. For that, there are natural lubricants or silicone lubricants. A lot of women will also take a little coconut oil and place that if they have discomfort. Some women describe feeling like sandpaper when they walk in sensitive areas, so that will help. Prescriptions that help are the hormone replacement therapies, either pills, vaginal inserts, or compound hormone replacements at a compounding pharmacy. So let's see, we've made about a little bit more than 10 minutes now. So I'm trying to keep these to less than 10 minutes. I will come back tomorrow with more precise and specific information on supplements and on prescriptions, the pros and cons of prescriptions, and the Women's Health Initiative, which decreased our prescription use for hormone replacements, and why that is and isn't such a great marker. Thank you for watching. This is Dr. McDaniel, GYN Corner, Saturday the 27th. Have a great rest of the evening. Goodbye.